Doctors of Reddit, who has been your worst? But I looked it up on WebMD patient. The other day I had a guy come into the ED in tears because he had wrist pain, and the nurse at his work's occupational health looked it up and told him he has multiple sclerosis. I'm not a doctor, but I did take my very elderly Nana to the hospital after I showed up to her house and found her slurring her words and behaving very strange overall. Now, my Nana is a major hypochondriac, and when she was admitted, the first thing she told the doctor is that she believed she was experiencing the beginning signs of Parkinson's. It turned out that she had mixed up a bottle of non-alcoholic wine with a bottle of regular wine, had drank the entire bottle, and was completely hammered. In this day and age of the internet, I'm still surprised people don't use WebMD more. Just this week I was in our workroom when a senior physician sitting next to me was on the phone and suddenly grabbed my arm while desperately trying to keep a straight face. The senior physician was talking to a 24-year-old female patient and the conversation was going, "No ma'am. You can absolutely get pregnant even if you don't orgasm. No ma'am, just because he's feeling nauseated the morning after doesn't mean you're pregnant." RN, but my favorite was when a patient's family member rudely insisted we give her mother, who had a major stroke, resulting in nearly zero swallowing capability, as much water as she could drink because I read a study online that said you can't aspirate on water because your lungs just absorb it back into your bloodstream. I looked her dead in the eyes and said, "Okay, then explain drowning to me." This will make my friend sound stupid, and she really isn't. When she had her first baby and was in that woozy/sleepless/new mom phase, she took the baby for her checkup and completely misheard when the doctor told her the baby had eczema. She got home and started Googling what she thought he had said, and called me in a panic, saying, "The doctor said the baby has emphysema. Why, that infant never smoked a day in her life." I had a woman come to see me because of abdominal pain. I spent a good 10 to 15 minutes of asking her questions to get a better understanding of what could be happening. I ended up ordering an ultrasound to assess for an ovarian cyst and some blood work. As she's leaving she goes, "Are you doing lab work for my prostate?" I had to bite my tongue so as not to laugh and said, "No, because you're not a male and you don't have one." She just said "oh" and left. Spoiler alert, she had an ovarian cyst. Like a couple people have posted, I've been on the opposite side of this, but I think it still fits. Back when I was a teenager I was a really big fan of human comics, and she posted a PSA about a condition she was recently diagnosed with called polycystic ovary syndrome or PCOS, and listed the symptoms. Aside from the ones I couldn't account for like fertility problems, I had nearly all of them, the biggest one being I hadn't had my period in over a year. My parents took me to the doctor who immediately booked me for an ultrasound. Turns out I really did have it and my doctor commended me for coming to him about it. I'm very thankful to Human for posting that PSA, I never would have known otherwise that what I was experiencing wasn't normal. I'm an RN in pediatric neurology. We frequently have families who refuse to put their kids on seizure medications regardless of the EEG findings and the fact that they, have seizures and stuff. One family did the research and attempted to cure the child's epilepsy with essential oils, over-the-counter CBD oil, yoga, metal ion wristbands, to balance the brain. They even went as far as having the kids' dental fillings removed and replaced with a non-metallic filling. There was the time that someone told us she didn't need medication because if you opened a fizzy can of Pepsi and put it under her nose she would come out of a seizure. If that didn't work, you could whisper Reese's Pieces in her ear and she would stop seizing. My least favorite visits are from parents who refuse to believe that their kid is twitching because they have motor tics and likely Tourette's instead of epilepsy. Like, if it was a choice between Tourette's and epilepsy, you should choose Tourette's all day long. Why these parents are hell-bent on giving their kids a diagnosis of epilepsy is beyond me. I just don't even know anymore. Not a doctor, but when I was in middle school the internet led me to believe that it burned when I peed, because I, who had not so much as held a girl's hand, had syphilis. Turned out I was just really dehydrated. Epileptic here. When I was 6 my teacher referred my parents to pediatric neurology. She was certain I was having absence seizures. The neurologist spent 5 minutes with us and decided since my older brother was gifted, so was I, and I was just bored in class, not having seizures. I was moved to a more difficult class and written off as academically advanced. 4 years later, I start having simple partial seizures and am out of school for months while we try to control them with meds. Teacher was right, I'd actually been having various seizures my whole life, and also had a learning disability that led to a ton of school-based anxiety.